Okay, good day to all of you. My name is Dr. Ibrahim. I'm a clinical oncologist. Thank you to 𝗖𝗿𝗿𝗿𝗿.com allowing me the opportunity to give a little bit of explanation about our facility and our specialty that we have in our hospital. First of all, what is a clinical oncologist? Clinical oncologists are doctors that treat cancer. So as a clinical oncologist, I do both chemotherapy and radiation therapy. So we have a more broad-based treatment. I did my basic clinical training in the UK and I lived there for 17 years. I came back in the early 1990s to set up a cancer hospital and cancer facilities at the University Hospital. Since then, I have now moved on to the private sector. I've done a lot of training and also learning on high-tech treatment in some of the top centers in USA while I was in the university. Some of the centers that I did my high-end radiation training was at the MD Anderson Cancer Center in Houston, Texas. I also spent about 2 months at the Johns Hopkins Radioterapi and Oncology Center and 1 month at Loyola University. Apart from spending time in US, I also did some training in Holland and also in Europe on advanced technology, not only on drug therapy but radiation therapy. My main interest is general oncology. I do all solid tumors. My main area of interest is actually in breast cancer, lung cancer, head and neck cancer, and prostate cancer. My main area of interest and specialty that I've been developing over the last few years has been a technique called SBRT, or stereotactic body radiation. This uses a highly precise radiation beam to target tumors in certain parts of the body without causing much complication or damage. Say for example, prostate cancer. Instead of doing surgery, we are now able to do SBRT, treating only about 5 treatments, half an hour each day as outpatient, not requiring any hospitalization, any anesthesia, any surgical intervention. I've also treated a lot of lung cancer using this technique. Apart from using cutting-edge radiation, I also do a lot of new generation of cancer treatment using immunotherapy and targeted therapy. I've been the pioneers on some in Malaysia using immunotherapy and targeted therapy in many patients and many tumor types. To help me sometimes to treat patients better, I have been using a diagnostic tool called NGS, or Next Generation Sequencing. What is Next Generation Sequencing? Next Generation Sequencing is actually looking at the patient's tissue or the circulating tumor cells in the patient's blood, and we send it for profiling to see what would be an exact match to treat the patient's tumor. So this will cut out all the guesswork about patient's treatment and zoom in directly to what will be effective and what will be helpful for our patients. So using all this new technology, new information, new tools is actually essential to help us to give you the best treatment. Okay. My advice to the patient is early detection and early treatment cures cancer. So what I would like to advise the patient is come for treatment early. Do not be afraid of coming forward for treatment. Nowadays, we have good tools, good drugs, and good diagnostic testing method to help you fight and cure your cancer. The earlier you come, the better the chances, the higher the success rate, the lesser the complication rates are. So if you do have any inquiries, please contact us at 𝗖𝗿𝗿𝗿𝗿.com. Thank you very much. Have a nice day.